Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal government announces new dates for rollout of Moderna vaccine exercise. States receive cold chain storage facilities for next vaccination. And for a number of hesitant residents of the UK for vaccination has been reported. While the deadline for the No Work, No Pay directive given by the Minister of Labour, Dr. Chris Ngige, to striking resident doctors to sheathe their sword winds down, the doctors continue a total and indefinite strike in its second week. This is coming on the heels of the coronavirus pandemic, which now edges close to 180,000 cases in Nigeria, with 2 deaths recorded in the last 24 hours after almost 500 cases were reported from 13 states. Meanwhile, after announcing a postponement of COVID-19 vaccinations, which were supposed to commence tomorrow, Tuesday, after the U.S. donated over 4 million doses of the Moderna vaccine, the federal government has fixed next week, Monday, for the second phase of the national vaccination program. According to Dr. Faisal Schreib, the Director General of the National Primary Healthcare Development Agency, the start date will now commence Monday next week. This is to enable NAFDAC finish its assessments and preparatory processes. So far, only about 1% of the population has been fully vaccinated, with Nigeria expected to receive a batch of vaccines through the African Vaccine Acquisition Trust, AVAT. Let's take a look at the coronavirus situation in the country.
Nigeria has seen a rise in number of daily COVID-19 infections in recent times, with the fatality figures also rising by the day. In the last 24 hours, Nigeria Center for Disease Control announced 471 confirmed cases reported from 12 states and the FCT, indicating a drop by 2 from the 473 cases reported earlier. Lagos, the epicenter of the disease, topped the chart with 219 cases, followed by Akwa Ibom with reported 102 infections. Ondo came in third place with 37 infections. Oyo had 33 cases, while 19 cases were reported in Kwara, and Rivers had 16 cases. 15 cases were reported in Ekiti. Delta registered 14 cases, Ogun had 7, the FCT had 5, and Niger had 2 cases, while Edo and Katsina registered 1 case each. There were 0 cases reported from Gombe, Kano, Osun, Plateau, Sokoto, and Kaduna states. The overall count of confirmed cases in Nigeria now stands at 178,086. There have been 209 discharges in the last 24 hours, increasing the total number of recoveries to 165,763. The NCDC also reported 2 additional deaths from COVID-19 in the last 24 hours, raising the fatality toll to 2,187. Presently, there are now more than 10,000 active cases in Nigeria, while over 2.5 million samples have been tested so far. In Africa, there are over 7 million confirmed cases and more than 177,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 202 million, while more than 4.2 million deaths have been reported.
The Chairman Steering Committee on COVID-19 and Secretary to the Government of the Federation, Mr. Boss Mustafa, says cold chain facilities for the storage of the over 4 million doses of Moderna COVID-19 vaccine have been received has been installed across the 36 states of the Federation, including the Federal Capital Territory. Mr. Mustafa insists that the vaccine rollout and distribution to states would only commence after NAFDAC certifies it safe for emergency usage.
As Nigeria grapples with the third wave of the COVID-19 pandemic, many patients have been left unattended to across states as resident doctors continue with a nationwide strike over poor condition of service. In Taraba State, the industrial action has now forced patients to vacate isolation centers as well as government-owned hospitals. In an interview with the chairman of the Presidential Steering Committee on COVID-19 in Jalingo, he appeals to the resident doctors to return to work, promising that all pending issues will be resolved.
My greatest appeal is to the resident doctors to return to work for the benefit and for also the ethics of their profession, which is not to allow people suffer unnecessarily and be visited with death as a result of wanting government to attend to their needs. The government will be responsive. Government will also take steps to see that the issues that have lingered for too long are addressed.
He also gives an update on the Moderna COVID-19 vaccines donated by the U.S. government, including the deployment and installment of cold chain facilities across states in the country.
The preservation of Moderna vaccines is different from that of Pfizer, that of Oxford AstraZeneca, because of the requirement of the cold chain facilities. But we have procured sufficient cold chain facilities and we've deployed them to the states. They are all in the 36 states and the Federal Capital Territory now. So once we receive the certification for the authorization for the emergency use of the Moderna vaccine from NAFDAC, we will begin the deployment.
Beyond the pandemic, the ongoing strike has brought the country's fragile healthcare system to a new level of uncertainty. The resident doctors are asking, among others, an upward review of the hazard allowance to 50% of consolidated basic salaries of all health workers and payment of the outstanding COVID-19 inducement allowance, especially in state-owned tertiary institutions.
The management of Kwara State Polytechnic Ilorin says it has put necessary machinery in motion to guard against the outbreak of the Delta variant of COVID-19 in the institution. A visit to the campus shows low adherence to the COVID-19 protocols, but a representative of the student union says enlightenment campaigns have begun.
It's free passage at the entrance gate of Kwara State Polytechnic in Ilorin, the state capital. No temperature checks, no hand-washing facilities are seen at the school gate. Students around the premises also don't have their face masks on. However, some school officials say they are not leaving anything to chance in ensuring that all the safety guidelines are adhered to.
So the first thing is that our science laboratory technology went to action. They produced soap, they produced sanitizer in large quantity, distributed them to the students. Again, we work with our Institute of Applied IoT, Institute of Technology. With the machine they produce here, we put them in places with water and the sanitizer. Everybody will wash their hands in some places. Again, we distributed the sanitizer we produce to both the students and the staffs to take home.
What is very important is the issue of make sure your hand is clean and make sure also that there is social distancing, and that is definitely we are doing that presently.
The president of the Students' Union says a sensitization campaign has been conducted to enlighten students on the highly transmissible Delta variant.
I can say it is from the student union government to the directly to the students, because some of our students, when we are dealing with students, it has to be with force. Sometimes we have to keep talking to them and keep sensitizing them so that they can maintain the protocols and the rules of the COVID-19.
Like other institutions, schools will need to enforce heightened health and safety protocols in order to keep students, staff, and communities safe.
Environmentalists in Yobe State have expressed concern over the improper disposal of the face mask and other protective materials by residents, saying it could spread more communicable diseases to the public. The general manager of Yobe State's Environmental Protection Agency told Channels Television in Damaturu that throwing the items indiscriminately may cause the children to pick and wear them. He reveals that government had provided dumping refuge points at government offices and public places, and so residents have no excuse to dispose used materials indiscriminately.
It's known fact that nose masks should be discarded. They are disposable after 24 hours usage. If you wear it today, at the end of the day, you dispose it and wear a new one. And some people are in the habit of disposing or throwing away these used nose masks indiscriminately. That means anywhere. This is a very, very dangerous strain, which is going to have negative consequences on the society. Because as you rightly asked, there's tendency that children will see it as a toy and use it. Because some children will be admiring people wearing nose masks. They don't have access to the nose masks. And once they see one thrown, there's tendency that that boy will take the nose mask and use it.
Let's now talk about vaccines and the cold chain facilities which we've just received. And joining us to talk more about this is the Director of Research and Head Microbiology Department, Nigeria Institute of Medical Research, Lagos, Professor Rosemary Aldo. Thank you for joining us on the program.
Welcome. Thanks for having me.
Tell us about the cold chain facilities which we've just received, or which has been implemented, we hear, across the states in readiness for the receipt of the over 4 million doses of Moderna which we just got. What are the risks without it? And do you think that based on our experience with the AstraZeneca, which was earlier rolled out, that there won't be anything amiss with the Moderna vaccine?
All right, thank you very much. So for the vaccines, generally, we have three types of vaccines. We have the whole viral genome, we have, which is either inactivated, killed, or using the...
Professor Aldo? All right, it looks like we've lost Professor Rosemary Aldo at the moment. We'll try to reconnect with her shortly as she tries to explain the vaccination and the facilities. But let's take you, and this is outside Nigeria. The Delta variant of the coronavirus appears ravaging through the U.S. with more hospital admissions. Some state governments in the U.S. are reinforcing the mask mandate, while the country sees children also coming down with the virus. Our Washington correspondent Maria Bird brings us this update.
The number of COVID-19 cases in the United States has skyrocketed as a result of the Delta variant.
Yesterday, CDC reported 103,445 new cases of COVID-19. Our 7-day average is about 89,463 cases per day. This represents an increase of 43% from the prior 7-day average. The 7-day average of hospital admissions is about 7,348 per day, an increase of about 41% from the prior 7-day period. And 7-day average daily deaths have also increased to 381 per day, an increase of more than 39% from the previous 7-day period. We saw 614 new deaths reported to CDC on Tuesday. 83% of our counties in the United States are experiencing moderate or high transmission, with Delta variant continuing to be the predominant circulating virus.
Some U.S. governors are reversing their course and reenacting mask mandates.
I realized that we needed to have more options for our local school districts to protect those children, and so I asked the legislature to redo the law that prohibited those requirements or those options for the school districts to protect the children. And so it was an error to sign that law. I admit that.
Children in the U.S. are greatly impacted by the Delta variant of the virus, as pediatric hospitals are beginning to run out of bed space. This has created a federal call to action requesting that all teachers get vaccinated.
I feel strongly that if you're eligible to get vaccinated, get vaccinated. Do your part to make sure that we're all safe and that we can reopen schools without interruptions. Again, our students have suffered enough. It's time for all of us to do our part to keep our students and staff safe. Students need to be in the classrooms. That's where they learn best.
The rapid increase in the number of COVID-19 cases may force legislators to require all Americans to get vaccinated. From Washington, Maria Bird, Channel Television News.
When we return after this break, we have a public health physician join us from the United States, and we're told that Professor Rosemary Aldo has since joined us. We'll also hear from her on the latest vaccination efforts in the country. Do stay with us. Welcome back, and we would like to invite, welcome to the program, Dr. David Ajibade. He's the CEO, Brain and Body Foundation, also a public health physician. He's joining us from Baltimore, and the Director, Research and Head Microbiology Department with NIMA, Professor Rosemary Aldu. She's joined us as well again. Thank you both for joining us again.
My pleasure.
All right, Professor Odo, I think I can hear you. So you were talking about essentially the efficacy of the vaccines and explaining the different types that we have. And this is in line with the present cold chain that exists for Moderna, which differs from the AstraZeneca, which had earlier been rolled out.
Which we know that these vaccines are really very, the nucleic acid are quite fragile. And so if the vaccines are not properly stored, they will be degraded and then they will not be potent. So it's good, it's nice to know that we now have the cold chain facilities. The Moderna vaccines are highly effective and
All right, unfortunately, due to this new normal, we can't hear Professor Aldu again. But let's go over to the U.S., Baltimore, Maryland. Dr. Ajibade, thanks again for joining us. What is happening in the U.S.? It's still #1 in the daily cases confirmed and the highest deaths recorded, over 600,000. Are things getting worse?
Well, it looks like it. Not as bad as it was last year, but it's beginning to climb back up, especially among the unvaccinated. And the demographic is changing, obviously, because we're finding younger and younger people being admitted into the ICU with the severe forms of the disease. And of course, with the new variants, now the Lambda, in addition to the Delta, it's becoming a cause of concern. It's not as bad as it was last year at this point, but it's climbing back up.
We also understand that some governors are backtracking to enforce the use of the face mask. Why the mix-up? Would you call it a public health thing, crisis, or perhaps a crisis is rather caused by politicians?
Yeah, there's a lot of, there's definitely a political undertone to it because the Republicans are against it. And of course, the vaccines, and in the southern states with the border crisis, they're saying it's been very hypocritical of the government to being so strong-handed with regards to the vaccines and the masks, while leaving the border not as protected as it should be. So there's a lot of mixes back and forth. And like if you remember earlier on in the pandemic, they initially said masks don't make a difference. Forget about masks, and then they changed again to say, well, it's only the real surgical masks that can keep the virus out. So people are getting tired of the back and forths, the restrictions, and some people are actually kicking back against it. So it's a bit of a challenge.
Our correspondent earlier reported on hospital beds filling in some counties, and this is with children who appear to be coming down with with COVID-19. What do you see in terms of, is it a thing with the Delta variant? Because we didn't see as much as these numbers that are being recorded now when we had a lot of the Alpha variant. What do you think is happening?
Yeah, definitely the Delta virus is certainly more contagious. Maybe not as dangerous, some people are arguing, but with kids, it seems like it's affecting them a little bit more than the Alpha variant was. It's still not enough, people argue, it's not enough to mandate vaccines for kids. You know, they haven't even done the test to prove that it's safe among kids. They haven't confirmed that it's safe to put among kids. But people are arguing too that these kids have been kept out of school for maybe a fifth of their lives if they're 5 or 6 years of age. And many of them are suffering psychological concerns. So the argument is that, well, it's still not as bad as what is happening with the adults, and therefore you shouldn't keep them out of school just because we're having a few hundreds who are coming down with the virus. And from what I've seen, and people I've spoken to, we haven't really seen kids being in the ICU, maybe on admission, but not in a severe form. And so the argument is that it's not severe enough to shut down schools.
How true is it about the pushback happening over vaccine requirements? We understand that there are protests against mandated COVID-19 vaccines. They appear to be popping up across the U.S. Yes.
So this is on both sides of the spectrum now. You have the Republicans kicking against it, the Democratic states a lot more vaccinated. Take New York, for instance. New York State is heavily vaccinated. But however, even within New York, they're saying that the Black population is just 1/3 vaccinated. And again, it pushes to the political and the cultural undertones beyond that. There's a lot of pushback now. The restaurants they're now mandating that the restaurants do not allow people to come in without having a vaccine, proof of having taken at least one vaccine. So and then schooling and like I said earlier on. So it's becoming a bit of a mess, I have to say. And being a doctor, personally, I've seen that vaccines have made a huge, huge, huge difference in the admission rates and all that. But the challenge now is with these new variants, the Delta variant and now the Lambda variant, which they're now saying that it's basically immune to the virus, that it basically can circumvent the virus. So luckily, it hasn't spread in the US yet. They're still calling it a virus of concern, but it's beginning to be a problem. So it's a moving target, let's just put it down. There's a lot of concern going on.
All right, we appreciate your time on the program. Stay safe, and thank you for joining us. Dr. David Ajibade, he's a public health physician, CEO of Brain and Body Foundation. Thanks for joining us again.
Thanks, Robin.
A new study by the ONS shows a fall in the numbers of those who are unwilling or unsure about having a vaccine to protect them from COVID-19. First Minister Nicola Sturgeon has urged Scots to enjoy the return of many freedoms, but they should be careful. After almost all COVID measures are removed in Scotland, social distancing is scrapped in most places there, but face coverings are still required in many public settings. Here's more on the global update.
In other parts of the world, Tunisia kicked off national vaccination against COVID-19 as 335 centers across 24 provinces started to vaccinate citizens aged 40 and above. A vaccination open day was held to promote the drive, with sites across the country welcoming people on a walk-in basis. The President's Office and the Health Ministry organized the event with support from civic organizations and volunteers. In France, extensions to its COVID-19 health pass came into effect on Monday, with restaurants, trains and commercial centers required to make checks before allowing people in. Police carried out checks of health passes in the 11th district of Paris, popular for its bars and restaurants. A health pass now has to be shown to eat in a restaurant, drink in a bar, access non-emergency treatment in a hospital, or travel on an intercity train, part of a government drive to contain a fourth wave of the infection. For the first time in 16 months, U.S. visitors could drive into Canada to shop or visit from Monday after Canada reopened its border, lifting its COVID-19 travel ban to fully vaccinated U.S. visitors entering for non-essential travel. Lines of vehicles waited to drive through the New York and Washington state borders. The move comes days after the Canadian government and border staff reached a tentative agreement on a new contract, bringing a swift end to a strike that began and ended on Friday. The cumulative total of confirmed COVID-19 cases in the United States surpassed 35.76 million as of Sunday, with the death toll reaching 616,828, according to the Center for System Science and Engineering at Johns Hopkins University. Specifically, the country's case count rose to 35,762,495 as of 19:21 Eastern Standard Time on Sunday. The United States had administered 350,243,106 vaccine doses.
Remember that the coronavirus can live on the surface for several hours. Continue to take responsibility. You can visit our website for more updates. You can see the latest story there, the second phase of the vaccination, which will begin next Monday. There's several other stories, breaking news. It's all at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.